February is Heart Disease Awareness Month. In fact, this upcoming Friday, if you want to wear red to bring awareness and to remind folks to donate to research behind heart disease and some of the efforts to try and help more people overcome these issues, you could definitely do that this upcoming Friday. But I came across something with St. Vincent's Medical Center. They're actually going to be doing what's called Women Heart of Fairfield County Support Network. It's an upcoming webinar today. It's happening at 6 o'clock this evening if you want to get in on it. And cardiologist Dr. Anja Wagner is here this morning, and she'll be participating in the webinar later today. But I wanted to kind of go through some of the facts and figures around heart disease with Dr. Wagner this morning. Good morning, Doc. Thanks for being here.
Good morning. Thank you for having me.
No, I appreciate you being here. A very important topic. True or false, is heart disease still one of the leading killers of men and women?
Absolutely, yes. Around about really 660,000 people die from heart diseases every year in the United States. So basically every 36 seconds, one person in the United States dies from heart diseases.
Oh my gosh, that's crazy to think that. What defines heart disease? Like, what is that?
So mostly we're talking about coronary artery disease. That's basically a blockage in the arteries that supply the heart muscle itself with blood. So the majority of people, really close to 400,000 people, die from what is now called coronary heart disease. But then we're also talking about heart failure, which is basically that your heart isn't pumping or supplying enough blood to your body. And then hypertension is also a very big problem in the States.
Dr. Wagner, what are some of the things that cause heart disease?
So it's basically certain risk factors that contribute to the development of heart diseases. And that's kind of high blood pressure if you don't really control your blood pressure. And a third of people who have high blood pressure are not even aware that they have high blood pressure. So you should really check your blood pressure once a year. Then high cholesterol, which is partially something we produce in our liver, but also comes with certain food. A big risk factor, which is avoidable, obviously, is smoking. Something that is not avoidable is a family history. So if you have a first-degree relative that died particularly premature from heart diseases, increases your risk. And diabetes and also a sedentary lifestyle is a contributing factor.
So everything that you just said, Dr. Wagner, those are all things that you can check on, because that was going to be my question, is how do you check for heart disease?
Yeah, so there are certain tests that we recommend, and it really depends on the patient. It really needs to be decided on an individual basis. But so in general, I think of it as a category of two people who need to be checked out by a cardiologist. One is a patient who has symptoms of heart diseases, and the other one is who has really significant risk factors that we just talked about for heart diseases. And then depending on the risk factors or symptoms, the cardiologist will decide what test he orders. Very often we do stress tests. So stress tests help us to see if there's a blockage in the coronary arteries. And also very other frequently ordered test is something called an echo. So it's an ultrasound where we look at heart valves and heart function. But these are mostly really for patients with symptoms. And a test we have been using more and more frequently for people who don't have symptoms but have risk factors for coronary artery disease is something called a calcium score. And that is a really quick CT scan that detects calcium in the coronary arteries and really helps us to determine if the patient who is at risk has early stage heart disease, so early stage coronary artery disease. And if that's the case, then we can be much more aggressive to really prevent the progression of the heart disease.
Dr. Anja Wagner is here. She is a cardiologist at St. Vincent's Medical Center, and we're talking about heart disease. February actually marks Heart Disease Awareness Month, and we're learning just some of the things that you should be aware of if you didn't realize the facts and figures around this. Still the number one killer of men and women across the country. So I'm curious, Dr. Wagner. You were saying like these are some of the things you can pick up on. What are some of the signs that you may have some issues with your heart?
Yeah, very important to know, Melissa. So both men and women can have more these typical symptoms of a heart attack that we are more familiar with, like chest pain or chest pressure, which can often really radiate to your shoulders, arms, neck, or jaw. And these symptoms usually, but not always, get worse with exertion. However, women particularly can present with rather atypical or less obvious symptoms like nausea, indigestion, fatigue, shortness of breath, or just back pain, or just really not feeling well. And because these symptoms are rather atypical, women are less likely to seek treatment immediately and are often really misdiagnosed.
I'm curious, Dr. Wagner. I was the health reporter actually at my old television station. I was the health beat reporter, and they were just coming out with new ways to do not surgeries, but be able to access the heart through like the vein. And it was like a less invasive way of doing, instead of doing open heart surgery, essentially. And I was looking to see, what would you say are some of the more recent, the latest technologies, some of the latest things being done if you do have to intervene with somebody's heart?
I mean, there are tremendous changes over the last years. For example, we at St. Vincent's do minimally invasive valve replacement, particularly for the aortic valve. We still do a lot of stents. So if you have blocked arteries, you go through an artery to assess the heart and basically place a stent to open up a stenosis or a blockage. But really the biggest changes or progress has been made in really replacing minimally invasively the aortic valve. Or something else that we have been doing more and more is if you have a leaky mitral valve, that we place a clip. So this really prevents open heart surgery. So we are able really to avoid more and more open heart surgery by minimally invasive procedures.
Wow. That's amazing. And really quick, one more time, Dr. Wagner, how many people a year die of heart disease?
So in total, in the United States, more than really 660,000 people die of heart diseases. That's 1 out of 4 deaths. Wow.
That's a lot. That's a lot. And I don't think it's talked about enough. Dr. Wagner, as I mentioned, is one of the people who's going to be there for the webinar happening tonight. It's being put on by the St. Vincent's Medical Center team. If you want to check it out, it's from 6 to 7 tonight. And we so appreciate you giving us just more information on heart disease, being here to talk us through this, Dr. Wagner, and thank you for your work in this field.
Thank you for having me.
Absolutely. Again, if you want to check more of that out, I would head over to St. Vincent's Medical Center. You can actually check it out on hartfordhealthcare.org. They should have it there as well if you want to go and check that out online. I would highly recommend learning a little bit more about it. The webinar is called Women Heart of Fairfield County Support Network. And again, the focus is really on peer-to-peer support and education for women living with heart disease. But as I mentioned, this month is Heart Disease Awareness Month. I'm sure there's going to be more forums if you wanted to learn more to go check it out. I would highly recommend that.